Thank you for this opportunity to present this piece of work, which has just been very recently completed. I'd like to introduce myself on behalf of the project team, which has been working for 18 months on this particular project. François Fitro, Antoine Seflecon, and Catherine Vizot.
Donc,
as you know, like Michel said, the challenge in the last presentations was to express what all previous people have said very well in a more, and I'll do it probably in a more clumsy way, but I will use the fact that some of this is repetition to go a bit faster. We've already spoken about the context today. It's an agency which already has its own ethics committee from the ENVF. This has a process to implement ethical analysis at the agency. This is currently underway. This project also stems from the results of an investigation carried out in February 2020 with agents on their ethical perceptions and expectations. This investigation, or this survey, was a quantitative survey with a questionnaire, and I was happy to have heard that it was more qualitative with the interviews as well. There were very similar results on the expectations and needs of staff members. I'm not going to present all of these results to you. Let me just reassure you on that. But I wanted to say that this had quite high participation as well. We did it in February 2020. There was some competition in 2020. And people were thinking about other things, of course, at that time. So participation between 15 to 17%, which is 117 completed questionnaires, which was pretty good. Out of all of the results that we have, which we compiled into a report, which you can see, there were some courses of action to better integrate the ethical dimension into the agency's practices. We also managed to identify some priority tracks from the management committee after receiving the results of the survey. I'm not going to read all of these priorities, but there are 5, and we worked on the tools mostly. In the discussions that we had, providing training. But if you don't have the tools, how do you train? So we therefore wanted to delve into developing tools, and we chose 2 objectives that you can see in bold here: draw up a set of values for ethics based on the agency's values and principles of action, and then to develop practical tools to help staff identify ethical issues and discuss them among themselves. This is how the Ethics Toolbox project came to be. This was in 2021. The purpose of this project was to contribute to the integration of ethical reflection into the agency's day-to-day activities. I think there are some differences with the goals that we had previously, which were quite similar, but ethical reflection in the agency's day-to-day activities, whereby the idea is for ethics to be a reflex. It isn't the cherry on the cake where you do these projects and you pop some ethics on top, and it isn't a constraint either, which I will explain later. But somebody also said it's not in our DNA, so why don't we try to put it into the agency's DNA if we could try to reach this goal? So the objective was to build on what already existed. We weren't going to reinvent anything. We built on the deliberative approach developed by awareness-raising workshops, which have already been presented to you. We drew inspiration from the Quebec model for the reasons we've already outlined. We also wanted to try to promote consistency with existing processes in the agency so that it doesn't add to the workload of colleagues, and ensure consistency as well with the CED's work in the Ethics Committee. We chose to use a certain number of levers, not only with the CED, who provided us with support, but we also wanted to consult some agency staff members who volunteered. And then finally, we coordinated and shared with the Séminaire project, which was taking place alongside this. The results. So we want to know what the deliverables are when we're presenting a project to the agency. This is what you have. It is the benchmark document. We basically wondered, like we would do what happened in Quebec, to have two documents, but actually we thought it would be better to present everything in one go. This document presents both the useful values to support the analysis of projects regarding public health ethics, but it also describes the process behind the development and implementation of the agency's projects. Because we want to have all agency projects involved in this, just like studies, surveys, monitoring systems, campaigns, etc. We called this the benchmark document because we've already talked about cases and frameworks, but we don't want it to be like a framework, which is more like an obligation or a standard or a guide. We want it to be a document that the agency will use and adopt as well. We'll see what happens at the roundtable and what people have to say about that. But this was the first version, which will probably be reviewed and edited over time, depending on our experience. So we have provided this as a version which you can adapt. Then you can send us experiences that you've had with it to try to improve it. We have done some prep work. We did the bibliography. We spoke with all CED members, and we also performed a survey with other public health institutions in France and in Europe to understand their methods and their tools. Then we also had a group of colleagues from the agency. We held 2 meetings to explain to them what the project was. And then we held 2 workshops. The first one was in June 2022, I think, which was to identify, organize, and present the main values likely to be raised by projects carried out by the agency. And the second workshop, which took place in November 2022, was to identify levers for successful implementation. Then we also had interaction with the Public Health Ethics Seminar preparation, and we presented the work at the first workshop and the seminar. And now we're at the capital S seminar. So ethical analysis is defined as being a reflexive process of questioning that seeks to identify the behaviours to adopt to do better so that we can live well together. So the goal of ethics is to make values concrete in a given situation, particularly when there is tension between values that are difficult to achieve through the actions put forward. We've used here the word to implement or to make them concrete. We didn't know if this would be understandable fully, but what we want to do with the word to make it concrete, to make sure that it is, that you best respect, or we could have said, you know, achieve or update values, but really it's the same thing. Next slide. So this is a process to inform action choices by reviewing the standards, and by that I mean everything in terms of regulation, laws, ethical rules that apply to the project, and then the values in the situation as well. It is a reflective, deliberative and contextual approach. We've already talked about this quite a lot. After this analysis, ultimately, we want clarification of the ethical arguments leading to action choices in a perspective of openness and dialogue. So these are all very important words, which is a 4-step approach. And I'm going to give you these 4 steps now. Step 1 is project description and background. We bring together different elements which should make it possible to describe the project in all of its different dimensions. Problem, situation, aims, goals, objectives, intervention, options and resources. So this is the basis for any professional's work, really. We also go a bit further. We also want to provide key elements to understand the socio-political, health and economic context of the project. We also look at what the standards and rules are which are applicable and the legal framework, and then we identify the parties concerned, populations, communities, institutions, and foreseeable consequences for each of these groups. Then we also try to assess whether there are any perceived ethical concerns among stakeholders by asking them, quite simply, or in the literature. So I think that this is a very important phase because it will govern the rollout of the following steps, and it lays the ground for step 2, which cannot be implemented properly if phase 1 hasn't been completed. Step 2 is formulating ethical questions or issues. We've also said dilemmas as well. It doesn't matter what word you use, what's important is formulating them. We look at what the values associated with the aims of the project are, and I'll talk about those later on, or the consequences of the measures envisaged, what their meaning and scope would be in this situation. Then we want to see what the underlying values for the standards or rules that define the project and its context. For example, protection of private data, or rules which govern biological sampling, that kind of thing. Then we will take stock by studying this range of values, and we take stock to see whether there is any kind of discomfort between the values and if the values will be a hindrance to each other. Therefore, we lay down the ethical issues which are raised during the project. And you've had lots of examples of tension between some values. And COVID has taught us quite a lot about this as well. So, without any ethical issue, the project is considered as justified from an ethical standpoint, and the analysis can stand there. But if there is an ethical issue, then we have step 3 and 4. Step 3 is to determine the priority values linked to the ethical questions or issues and assess the options for action in relation to these values. So we overlap and assess the tension between values, and we try to find some kind of consistency. Then we look at the distribution of benefits and losses according to the different action options which may exist in the project. And then we also assess stakeholders' views on priority values in this situation. So you end up with a table of priority values which can then lead us to choosing a given solution. Then step 4 is to choose the option that best meets the priority values while minimizing the impact on other values. So justify and validate this choice. We firstly determine the option, then we explain the arguments that have led to this choice, and then we draw a conclusion to take a step back and assess the reasonable and legitimate character of the different options put forward. So now we've talked a lot about values. So I'm going to show you the main values that can be raised in an ethical analysis in Santé publique France projects. I want to insist on main values which can be raised during the analysis in Santé publique France projects. These aren't the values that are engraved in stone. The values and principles exist on the website. You can see them in activity reports. But we worked with the working group so we wanted to make sure that the values of Santé publique France currently on the website are explicitly or implicitly indicated in this. So here we wanted to have a broad sweep. I'm not going to go through this list, but I wanted to talk about our thinking behind all of this. Out of all of these values, they're recognized by the society, and we thought that some of them were more specifically linked to to public health objectives. We've chosen 6 with health at the forefront. And once again, these are not values that are engraved in, set in stone. This is a list that was drawn up as part of our actions and projects at Santé publique France. These are the ones that are most representative. But this isn't an exhaustive list. And then there are important values linked to professional expertise and institutional expertise. And then there are values that are very important but haven't been put in a specific box. I don't want to list all of these. That's not the point of this. And there is a lot of text and definition in the document. But I wanted to give you some ideas which will help to take these values into consideration. What's important is for them to be understood jointly by the team which is performing the ethical analysis. This is why we have made quite long list of suggestions in the document. This is a guide as well, but it isn't a checklist with boxes that you have to tick. They are chosen in each situation and in each context, but none of these are absolute, and the weight given to each of them will differ depending on the situation. In one project, it will be these ones that are the priority. In another project, it will be something else. And then you basically call on judgment and some flexibility. These are the main messages I wanted to highlight about the values. So now you may say, okay, there are 4 steps and there's some values, and then what happens? We have tried, in the first document, it's always difficult to tell you what you need to do. But we've put our practice and our experience there to give you some potential options. But you will be the ones to tell us whether it works or not when you've used it. So when you are designing the project, that is when you take these into account. There are some different features which mean that there can be potential ethical issues. Namely, we have vulnerable populations or those at risk of stigmatization, biological samples for non-diagnostic purposes, and then wherein there is action on individual behavior, the sensitive information context as well, high social expectations for the project, or scientific uncertainties or controversies. We think that as well that this should be linked to the Project Evaluation Advisory Committee. And then from design, we need to also be careful with any ethical issues which may arise during the project rollout. Very quickly, I will tell you how. For steps 1 and 2, the project team responsible for setting up the process can usually lead steps 1 and 2 if they can bring all of the elements together. But if there is ethical question and you have steps 3 and 4, then you will create an ad hoc group with internal and external people, multidisciplinary people as well. So you need to define working methods to see whether there is support from the CED as well, whether that's an option. I'm going to finish up very quickly. We also provide practical elements to try to uncover difficult situations, and don't hesitate. The project team shouldn't hesitate to find support, internal ethics reference points, CED, or outsiders as well. So I'm just going to finish as well on the need to document the process as well. There needs to be a written traceability. Even if it's just a light document, it needs to lay out what the steps are and the choices. What's also very important, it needs to be done, because then in the file you will have traceability for the ethical analysis, but also when you're amending the document, you want to be able to capitalize on experience. We've also said that you may have to do case studies as well for the training. So all of that can be part of materials that are used jointly. We've talked about creating spaces and sharing. So documenting the ethical analysis process, an example that you have for a project which could serve other people, that's very important. I had also added a few more points, levers for action that had been defined with the working group. But they have already been discussed today at length. So I think it's a useful document, but it isn't enough. You need support as well. You want to create an environment conducive to the ethical process. In the slide as well, I had put ethics at all stages. I have heard different words today, such as publication, impulsion, organizational pressure as well. So these are all things that we need to put in place. I want to warmly thank the members of the CED who have supported us, Grégory Aiguier specifically, and Michel Désy, who were our contact points, and all of the members of the consultation groups as well.